Name this chest position anywhere you like it. For example, chest sitting on table. And why a chest sitting on table? Well, how many times do you not have a patient that's a little bit weak on the feet, has difficulty to stand, but is able to sit for a few minutes on his little stool in front of the wall stand? Because your optimal goal, of course, is to do your chest in an upright position. The problem is, those little stools are not comfortable. For the patient, it's very difficult to keep your balance. And as a radiographer, you always get nervous about how is this patient going to sit on the stool for a longer time. When you have a solution like this, it's much easier. You can lower the table to any height, even if the patient is capable of sitting and coming out of a wheelchair. They will sit on the tabletop. You, as a user, will raise this table to a comfortable working height. And what you will get is a system where a patient could sit here on this wide tabletop. They can hold on to this tabletop in a very comfortable way while you position. And then what you will do is you will bring the wall stand towards the patient rather than bringing the patient towards the wall stand. So now I can make my chest exposure. The patient is sitting comfortable on this wide tabletop, and if, for what kind of reason, the patient would fall down, they would fall down on this tabletop. So it's also more secure. We do not only see this being handy for adult patients or patients who cannot stand that long, it's also being used for pediatric patients. How easy would it not be if you can position your patient here at the end of the table? Someone, if needed, with a lead apron can hold up the arms of this child, and you can make an exposure while using one of the 5 implement chambers. So a lot of advantages, the flex room, but also this VM wall stand, the mover wall stand, will bring to you. What you have seen now is that you can do all examinations in horizontal way. Special projections you can achieve because of this unique vertical movable wall stand. But they were still all in this direction. The thing is that with one simple handling, I can now change the position of this wall stand towards the table, but also towards your own room layout. Because maybe it's much easier to work in this way if the patients are changing and coming from that side. And now the only thing you need to do, press again those 2 buttons. The system will automatically line up for you. You don't even have to worry how to do this. The system automatically will go to the right position, even with the right angle if needed. But you're ready to perform, for example, now a chest in this way. So multiple ways to set up your own room. Also multiple ways to adapt the system towards your patient. Another examination you might need is stitching. Stitching of the full spine or the full legs just by creating 2 or 3 exposures while the system will stitch those images together automatically. How it is done with the C90, it's very simple. The patient is going to stand in front of the wall stand, either on top of this footrest or for spine, they can just stand on the floor. They can comfortably hold on to the system to find more balance and to stand in a stable way. The user only have to open the collimator. They will define the region of interest, for example from C-spine to lumbar spine, and the system, depending on the length of the patient, will decide to create 2 or 3 exposures. All done automatically. But you can imagine that if you have a child or any patient in that regards standing here and they will hear something moving behind their back, or they will see this tube angle in certain directions, they might be curious and maybe turn around to see what's happening. To avoid these mistakes or these patient movement, what we can do is very simple, do a test run. What I can do is now say to the patient, what I'm going to do is make a test run so you will see how the procedure is done. but we are not using any x-rays right now. So the patient will see, hear what's happening inside this room. And now, when they are instructed, you can say, and now I will move back to the control room. And now we're going to do the real run, so stand very still during those 3 exposures. It has been proven that because of this, patients are more at ease. They know what's going to happen, and you have a better success rate while creating those 2 or 3 exposures. So you just saw how stitching is being done on the C90. And of course, the 3 images created will be automatically reconstructed into one nice overview of the spine or the legs. But there's much more what a C90, especially in combination with this movable wall stand, can do. For example, take the cross-table lateral exposures. Wouldn't it be easy to make those exposures while the patient is on the table and the patient has difficulty to move, but still do them in an automated way while using one of the 5 implement chambers? This is what you can do if you have this movable wall stand. For example, you have a patient on the table, difficult to move, but you can move the patient towards the detector. The patient is a little bit lower on the table, so the only thing you need to do is to focus on the patient. You position anywhere you need to be. In this case, you focus on the C-spine. You collimate on the patient, and by only pressing one button on the tube head, you will see that the detector will automatically align. Now you're going to make an exposure of the C-spine while using one of the 5 implement chambers. Optimal IQ, optimal dose. This is what matters. The only way to do this, if you will not have such a movable wall stand, is to use a wireless detector. A wireless detector that anytime you have to put next to the patient, it's done with a manual exposure technique, and every position you have to move this detector accordingly. Rather than making those lateral exposures with a wireless detector and manual technique, it's much better to pay more attention to your patient, focus on the patient, and just move the system anywhere you need. Press a button again on this lever tube head, and the system again will automatically align to any position that is possible and needed. Another projection that is needed is, of course, if you have a hip fracture. Then this exact perpendicular view is not helping you, because you need to do this at a certain angle. Also, this is possible with this movable wall stand, because you can not only make the exposures like this, but here the system itself can move and angulate in different directions. Up to 45 degrees in this way, up to 25 degrees in that way. So also there, a movable wall stand will help you to make your exposures in a better way, independent of what kind of cross-table lateral exposure you need. If we have done the cross-table laterals, of course, you still want to do sometimes 3 exposed images. And for that, we can also program the system to only move, for example, in this case, the tube. Sometimes you do not want the wall stand to move at the same time. So also those components can be programmed individually. So in this case, you would need, for example, the wireless detector. With us, it's called SkyPlate. SkyPlate detectors can always be added to any of our C90 systems and are used for 3 exposures. And in this case, it will be, for example, for weight-bearing feet. The plate itself can have a point load of 100 kilograms. If you want to exceed and extend this, we also have what we called a Detector Protector. So it goes over the detector, and now a patient up to 226 kilograms can be examined without damaging this detector. So again, many flexibilities this C90 system has to offer. Again, the Eleva tube head. Again, the unique concept of the flex room, the movable wall stand, sky plate detectors, all to make your examinations in a better way. But this is only one part of your examination and your examination room. Of course, you also have a control room. And what we have there and what the advantages are with our Eleva platform, I will show you right now. So the system itself, with all the unique features, is one side of the story. But of course, the heart of the machine, where you do all the processing, where you set your generator, it's done here in the control room. The control room where we have the Eleva user interface. Eleva user interface within Philips, the common platform used on all our DXR systems. If it's a mobile, if it's fluoroscopy, or any of our DR rooms, the Eleva is the user interface where you do all the patient administration, where you do all the generator settings, but as well all the processing will be done on the exact same user interface. And what is for the C90 a new feature and so unique on this user interface is that right now we can also open the camera that you saw earlier on the Eleva tube head as well inside the control room. Because how many times does it not happen that you positioned a patient in a perfect way? You moved away to release your X-ray and you are in the control room, but this patient has moved in the same time as well. If you would not have picked it up, because sometimes those movements are just a little bit, then you could release an X-ray where the region of interest is not in the central beam anymore, and you have to do a retake. Not anymore with the C90 and the camera functionality, because right now I can open the same camera as you have seen on the Eleva tube head, and I can open the collimator, and now I can see if the patient is still centered towards my exposure. If needed, and we also see this being used as well for training institutes, a trainer can also guide, for example, a student who just positioned a patient, and here they could say, well, adapt the collimation a little bit more or less, depending on their needs, and then release the exposure as well. So the functionality of the camera at the tube head, again, was easier positioning without bending over the patient, but the same camera will give you as a user a way to check just prior for releasing the exposure if the patient is still in the center. And if you also are using the C90 in a training environment, you can also guide your students in a better way without moving with them and looking over the shoulder. No, you can do this from here, from the control room, giving more confidence to the patient as well as to the student itself. Another thing we did not highlight yet is that on the Eleva tube head we also have the image reviewing. So if I would take an exposure on this patient, the exposure will be here on the Eleva user interface, but at the same time you will see that image appearing on the Eleva tube head inside your examination room as well. The big advantage you will get on this is that you can just keep on working on the patient, and any patient and any exposure being made on this patient will appear on the tube head as well as in the examination room. That means I could move back to my patient, focus on the patient, review my images anytime I need in a large screen. Another advantage of this live image display on the Eleva tube head is that, for example, a referring physician who's working on a trauma patient with a lead apron is just requesting, I want a chest, I want an abdomen, I want a pelvis. But to see those images, they always had to step out into the control room to see if they needed additional exposures. Right now, every exposure being made can be reviewed in here, and they can base their diagnosis on here, saying, okay, maybe I see something here in the hip, I also want a pelvis or an additional hip exposure. I also hear that many customers will say, I do not want to show this image because I do not want to go into a discussion with, for example, a parent or the patient itself. It's all up to you how you want to treat these images. We can program it that it only pops up for a split second and disappears. We can also program it that it will stay longer and you have to confirm and continue with your operation on the patient. Those kind of flexibilities we offer. But also what we're going to offer is a function that you can decide upfront not to show an image at all. These kind of things matter in your daily business. If you go back to the control room, the Eleva user interface designed in a very simple way. You work from left to right. Your patient list, you select your patient, you will do your examination, and when you're done, you just click one button, complete, and the image will be sent to PACS. Again, an Eleva system is designed to do an examination in only 3 clicks. Select your patient, make your exposure, send to PACS. It's as simple as that. Of course, you can do more. You can do annotations, you can do contrast brightness, you have other functionalities where you can manipulate the images before you send it to PACS. But next to all the functionality we have, in the end, it's all about image quality. And image quality has always been very important for Philips. Unique image processing, for years, the golden standard in radiology. But now with the Digital Diagnos C90, we introduced the latest unique processing called Unique 2 image processing. With Unique 2 image processing, we even make those details better. A more black homogeneous background. But also the way you can manipulate the images if needed have been made easier for you as a user to do so. Next to the image quality, also the whole new Digital Diagnos C90 is based on the Windows 10 platform, with the optimal security that you also seek within your hospital. Next to this, the displays that we are using are medical graded monitors, so also they're building more confidence inside your examination room and not only on your PACS monitors. All in all, the Digital Diagnos C90, many versions that we can offer, all built on the great components like the Eleva tube head, the live camera, the Eleva platform, the motorization offering that we will have, making this room into the ideal room to do high volumes, optimal patient care, but as well, of course, the best image quality as possible. And in the end, when you're done, at the end of the day, we can also park the system in any position you like, also to make the room available to be cleaned in the best way possible. And any position you would like the system to move to and to be parked aside, you just press again those 2 buttons on your remote control and the system will do the rest.